The first case of the H1N1 influenza in Oklahoma has been confirmed. The state health department announced today the Centers for Disease Control and Prevention confirmed one case of the swine flu and are testing 4 more suspected cases. State epidemiologist Dr. Christy Bradley said a Pontotoc County woman had the swine flu, was not hospitalized, has recovered, and is no longer contagious. The woman returned from a trip to Mexico in late April. Officials held a press conference on Tuesday morning to announce the latest information.
Late last night, we received notification from the Centers for Disease Control and Prevention in Atlanta of the state's first confirmed case of the 2009 H1N1 influenza, previously known as swine flu. The identification of this new flu virus in Oklahoma was anticipated as our state becomes one of numerous states to identify infections with this virus. The case patient is an adult female from Pontotoc County who had recreational travel to Mexico during her exposure period. Starting on April 25th, she began experiencing typical influenza symptoms of body aches, chills, sore throat, and a cough. She has since recovered from her illness. Very proactively, she recognized that she could be contagious to others and stayed home from work until she was cleared by her physician to do so. Our county public health nurses have interviewed the patient and any potential contacts to determine if there were other persons who reported illness and needed to be tested. We are happy to say that because of the preventative measures that this individual took, we feel that there has been no additional transmission within the community. This announcement should not cause any interruption in the day-to-day activities of Oklahomans. Although this is a brand new type of influenza that we currently do not have a vaccine for, most affected persons in the United States are experiencing a typical influenza-like course of illness that's consistent with seasonal flu. And I will add that in our enhanced surveillance, we have been having more specimens test positive for seasonal flu A and flu B than any other virus. So there is still quite a bit of regular seasonal flu circulating within our communities.
Confirmation of this case in Oklahoma really isn't cause for panic. We knew it was only a matter of time before we identified this virus in our state, and efforts are already underway, as you heard, to control that. Over the next several weeks, we're going to continue our heightened surveillance efforts, and as we identify additional cases of the virus, we'll work closely with physicians and other medical providers to aggressively implement efforts to reduce transmission and spread.